Welcome to the GOYA Gatherings podcast, a serene and inspiring space where the worlds of yoga and wellness converge. Every episode is a journey into the heart of yoga, offering you deep insights, uplifting stories, and practical wisdom. Our conversations are designed to inspire your journey and illuminate your path to well-being. Please remember that the views expressed by our guests are their own and do not necessarily reflect the opinions of GOYA Gatherings or its hosts.
Today, I'm so happy to have Dr. Lauren Turner, licensed clinical psychologist, yoga teacher, Reiki master, and a member of the GOYA leadership team on the podcast. Dr. Turner's areas of expertise include trauma, post-traumatic stress disorder, anxiety, yoga therapy, bariatric evaluations, LGBTQ plus concerns, adjustment disorders, and both neuropsychological and psychological testing. She is a trauma and PTSD specialist, and she's also a certified clinician in eye movement desensitization and reprocessing, which is EMDR. She works with teen, adults, couples, and she has a comprehensive approach that honors the intricate connection between mind, body, and spirit, with a special emphasis on the healing and balancing powers of yoga. I'm so thrilled to have her as part of our leadership team, and I'm so thrilled to have her joining us today on the podcast. Welcome, Lauren. Good to have you here today.
Thank you so much. I'm excited to be here.
Wonderful. So today we're gonna just pick your brain a little bit because you have such a diverse background, and that's one of the reasons why we also asked you to join our team here. But I think there's so many amazing aspects that people aren't even aware of in regards to mental health and yoga and all the things that come with that package. So I'm going to start today with asking the first question that we thought about. And it was, how is yoga being integrated into mainstream healthcare systems? And what benefits have been observed in patients who incorporate yoga into their treatment plans? Because I think a lot of people don't realize that in some countries, yoga is part of the mainstream healthcare system, not so much in our Western North American culture, but I think that's changing. So maybe share a little bit about what you've seen and what you've experienced there.
Yeah, so I think you're right. I think that it is definitely more accessible in other countries, more of the norm maybe in other countries. But it is catching on, and it kind of depends on even just the area that you're from or resources. And of course, just having knowledgeable staff who maybe have been trained in yoga or practice themselves. But as far as what I've been seeing from different places, so I worked at a hospital in Fond du Lac, Wisconsin. It was called Agnesian Healthcare. And so there, basically what we started to do is we started to integrate yoga with different populations. So I worked in the oncology department. I worked in palliative care and physical rehab for people who had had strokes and things like that. And, it was really interesting because I think that people were really kind of skeptical about it at first, or not really sure how this would be helpful. And then they kind of saw those results. So I think a big part of it, and I'm sure we'll get into this more as we go through, but things like inflammation, heart rate variability, lots of benefit with things like GI issues, right? Because if we're activating our parasympathetic nervous system, our rest and digest, that's going to help with all those GI issues. And of course, a lot of mental health stuff too. I mean, I use this a lot with like PTSD patients. I can't say enough about the mental health aspect in healthcare and how yoga is helpful across the board in that.
Right. And I mean, you're a traditional practitioner in the sense that you're a licensed clinical psychologist. But do you see that bringing that into your practice has really made a difference for your patients?
Yes. Actually, it's funny. Yesterday, I did yoga therapy with a client for the first time. And he is a client who, well, his background, he's Orthodox Jewish. And that wasn't really like something that he's ever done before, but he was so chronically tight and tense and so anxious that he was holding a glass of water and it was shaking, like the water was coming out of the glass. His nervous system was just so overwhelmed. And so I suggested, like, okay, let's go to the yoga room. Let's just do some deep breathing. Let's do some grounding. And he was shocked by the difference, even just after a few minutes did with that. So yeah, it's cool that people kind of see it and they feel that shift in their body.
Right. Because I think this, like most things yoga related, is you have to just do it and see the result, right? Because it's really hard to explain it to the layperson or the person who has never practiced yoga, and especially in a treatment type setting, right? So can you share or discuss some of the specific health conditions for which yoga has shown like really great promise in complementary or alternative therapy?
Mm-hmm. Yeah. So, I mean, just off the top of my head, a few that I could think of, like I was saying, any of the mental health related issues from PTSD, anxiety, of course, depression, all of those things. Absolutely. And then, things actually, sometimes this can surprise people, but anything related to inflammation. So heart disease, rheumatoid arthritis, things like that. Because yoga, again, if we're talking about like the nervous system, right, and being able to kind of regulate and calm that reduces inflammation, which therefore reduces all of those inflammatory sorts of diseases in the body. So can't say much as far as if it's going to, reverse things, but it certainly has a lot of implications as far as prevention and things like pain management. I think is a big one too. If people are going through, surgery recovery. Like I said, I worked in the oncology department, so I was mostly working with people who were going through like chemotherapy and kind of trying to figure out some ways that they can either, use pranayama to kind of help them through those treatments, through their pain management, ujjayi breath to get through difficult situations if they're anxious, if they're having, flare-ups of pain. So yeah, I think there's a lot of places for this.
Absolutely. And when you touched on inflammation, I think what people don't realize is inflammation is the underlying symptom of most diseases. I myself was an oncology patient, so I'm fully aware of, the inflammation being so critical to remove that inflammation. And with any sort of things like diabetes, cancer, MS, all these types of things, inflammation is always the underlying, symptom that we see. So, and I used, pranayama often to try to, reverse that inflammation. Whether it was completely reversed or not, I'll never really know. But I think it doesn't hurt to try something different, right? Because, just taking another medication to, alleviate that inflammation often causes other symptoms, right? And I'm not saying not to take those medications. I'm just saying that often one thing leads to another. And sometimes the symptoms and the results of taking other medications also causes different types of inflammation throughout the body. So it's sort of like a revolving door.
Yeah.
So why not try something that is non-invasive, right?
Exactly. Well, that's what I always tell people. And the fact that you just brought up, pranayama, I mean, I think the first part too of integrating this with people who maybe are not familiar is reminding them or educating them that we have 8 limbs to work with, right? It's not just the asana. It's not just the standing on your head and doing the splits and all of those things. There's a lot of other parts of this that can be helpful, right? So in my work as a psychologist, I typically use the first 4 limbs, and I use the first 2 a lot, just in conversation with clients. And, we talk about like ahimsa, how are we taking care of ourselves? And I think if you are, a person who's going through a medical emergency or something, diagnosed with a disease, it's really life-changing. It can be helpful to kind of just use these things it just gives you a more spiritual aspect, I guess. And also for people who maybe are, not super comfortable with the idea of seeing a psychotherapist and doing traditional therapy, this could also be a nice way to kind of get in there and work a little bit on that too. And you don't need to be a trained psychologist to do any of that, as long as you know your yamas and niyamas.
Yeah. And for those of you who are listening who have not been exposed to the yamas and niyamas, that's what Lauren's referring to, the 8 limbs of yoga. And you can Google that and you'll find all kinds of information on it. But it's the non-physical practice of yoga, everything we do in our daily lives that basically can complement everything else that we're doing. So as we're both in North America, and I think I've seen this firsthand in healthcare settings, I see the challenges of bringing yoga into the mainstream and the barriers that still exist in terms of accessibility, in terms of insurance providers willing to cover it, in terms of just general acceptance amongst medical practitioners, right, who are really wanting the status quo to stay as it is. So how do you think we can sort of push beyond those barriers?
Well, I think it helps to have an ally in the system for sure. So when I was talking about that particular oncology department, the reason that I started working in that oncology department is because there was one oncologist who was very open to the idea of yoga, who practiced himself. I can't say the other ones were really that supportive, to be honest. But I think if you can find an ally, somebody who's in the medical system, who knows the medical system, who can kind of help, and also just educating people. So part of what I did was I went to the oncology staff meeting and just did a presentation for the nurses, the techs, the doctors about how we could incorporate this for pain management. Like I was saying, right, like the breathing techniques, relaxation techniques, and just different ways to kind of talk about it. And I think if you just educate people, it's kind of hard to argue, the benefits. And especially if we're talking about healthcare, the mental health aspect of healthcare. I mean, it's just, I think it's pretty much impossible to argue that yoga has a place there. In fact, if you're familiar with Bessel van der Kolk, who's the psychiatrist who wrote The Body Keeps the Score,
right?
He has a huge trauma center in Massachusetts, and he won't even take a person on as a patient unless they admit to having like an active yoga practice, because he believes that is like, one of the keys for curing trauma.
Right. And that's such a great book. And, I don't have any link to him in particular, but I have read that book 3, 4, 5 times. Mm-hmm. And every time I read it, it just resonates. And it's so on point that, for those of you who haven't read it, you really should, but it really tells us the story about how trauma affects the body and how the body remembers trauma, and how, in order to release trauma, the things we have to do. And it sounds so simple, and yet, some of the traumas are so deep and so long, and some people don't even know they've had the trauma, right? And I'm sure you've experienced this in your own practice. So I think for people who might be curious about, say, what you do in your daily practice, what does that look like when you see a patient, when you're using psychotherapy and yoga together?
Mm-hmm. Yeah. So, I mean, it depends on the client, of course, but I think a big part of it is just teaching people to get grounded in their bodies, because when people are anxious, they're not in their body. They're floating around outside of their body. They're thinking about what's coming next. And I have to do this thing later. And oh no, what if this happens? And all of the what ifs and this and that. They're not in their body at all. So sometimes even like people always think that this is a crazy thing to say, but sometimes, like if I have a client who's having an active panic attack, I'll tell them to start doing push-ups. And they're like, why? like they're kind of like, wait, what? But it gets you in your body, right? If you're doing a push-up, you're not thinking about all the oh no's and what ifs. You're thinking about, wow, this hurts and this is hard. And I don't want to do this. Why is she making me do this? But it takes you out of your head and puts you in your body. So sometimes, things like a chair pose, perhaps, where you're really building heat and it's not the most comfortable thing, or holding planks. Those are the things that kind of force you to get in your body.
Right.
And if you're doing breathing, what I teach people too is like, I'll teach them to kind of count their exhales. And when we're doing this deep breathing, we're not focusing on the last breath. We're not focusing on the next breath. We're focusing on the breath right here, right now. And so that automatically is putting us in our body, is automatically having us practice mindfulness without even trying.
Yeah. And it takes us back to exactly where we're supposed to be, which is the present, right? Which so few of us live in the present because we're always thinking about yesterday or tomorrow.
Right.
And it's not a cliche. It is how the human specimen actually functions, right? It's almost like we forget that this is here and this is now. And I mean, I've done that my whole life. It took me a long, long time to learn the practice of being present. And even, when I try to maintain that practice, you still slip up all the time, right?
Yeah.
And you find your way into those fear moments and what if and oh no. So what would you say, like you've worked with teens as well, is that correct?
Yeah.
Yeah. So are you finding that teens are struggling more and more these days with mental health, and that yoga is another way, that is another tool for them?
Yeah, absolutely. Absolutely. With all of the, social media. So thankful I didn't grow up in the era of social media as a teenager. Just all the comparing and, I think sometimes too, confidence building. So when I teach yoga, especially in a therapeutic setting, I always, talk about like bringing your shoulders back, lifting your chin, take up space, like just feel yourself in the room and expanding, and warrior poses and feeling really strong and stable. And I think little things like that, little cues like that can make a big difference in, self-esteem, depression, anxiety, all of those things.
Yeah. And I think it's just such a different world that these kids are growing up in.
Yeah.
They've got just so many other avenues that they can use to manipulate how they're feeling about themselves, how they see the world. It's as wonderful as technology is on another spectrum, I feel like some of it is quite tragic, right? It's just, especially when you say, for example, the comparison aspect, right? When I was growing up, I thought, we did that as young girls. We did that all the time, comparing ourselves to this supermodel or that supermodel or whoever. And I thought, oh, great. Once it started to switch and I noticed that young women started moving away from that, and then social media hit, and then it's just full spectrum. Like, I mean, and the sad part is often what they're seeing isn't even real.
Absolutely.
But it's affecting them because they're living in that world, right? And you kind of can't live in that world, cannot not live in that world because everyone's living in it, right? So, I mean, I suspect that, that'll only increase as time goes on, because it's just going to get, it's going to become even more predominant, if that is even possible. And then do you work with seniors as well? Do you find working with any dementia patients, Alzheimer's patients, that type of thing? Have you experienced that?
Yeah, actually, when I was living in Chicago, I worked for, I want to say maybe 4 or 5 years in it was an inpatient psychiatric unit, but it was all 65 and older. So it was primarily dementia patients. Yeah.
Right. Mm-hmm. Wow. And I'm sure that was a challenge into itself, just the nature of the disease of dementia and, just, coping. But, again, bringing some light to that environment with yoga, I think is an amazing way. So, I mean, for me, I think the biggest thing is I would love to see this more, and especially the North American mainstream. Australia, my understanding, is just about to bring it into their healthcare system,
Oh, that's great.
where insurance providers are covering it, where it's part of the medical plan,
That's amazing.
which makes me feel like we're so far behind here.
Yeah.
And so, you know, every little bit that everyone can do will make such a difference. And you're right. Unfortunately, you know, you've got to have someone in your corner sometimes just to get the word out, right?
Yeah.
But it's, you know, I think that's all we can do at this stage, right? Just keep plugging along and letting people know that this isn't, you know, this isn't unusual to have this as an alternative therapy. In many cases, you've probably already done it as a therapy and don't even realize you're doing it, right?
Absolutely.
And I mean, I'm sure you've seen that in hospital settings, especially for those healthcare providers that are integrating it on their own, which I sort of see a little bit more now, where nurses and some physicians are really asking those types of questions and really really trying to implement it without having it being implemented on paper per se.
Yeah. Well, and I think too, you know, for those yoga teachers who maybe are interested in trying to get that foot in the door, something that that I did that kind of started all of this in this hospital system was going to the community programming outreach coordinator of the hospital. So a lot of times hospitals have like those free community talks where they talk about, you know, ways to reduce inflammation or ways to improve sleep and, you know, different sorts of just resources for the community. And, you know, offering, hey, could I do a yoga class? Could I do a yoga for oncology class or a yoga for diabetes, whatever it is that you maybe are interested in? And I think more often than not, people are interested. It's just a matter of letting yourself be visible and letting the right people know that you're interested and available to do something like that.
Right. And so, just to make it clear for those listening, that if I'm not mistaken, what Lauren is saying is that you don't have to be a psychologist or a psychotherapist to do this type of work. I mean, you could take your teaching into a facility safely and effectively, and just hold space for people as well, right? I mean, you know, oncology departments are a great one. Palliative care are great. Seniors facilities are great. There's just so many opportunities. It's just that we just have to keep knocking on those doors until someone lets us in, right? And yeah, you might get turned away many times, but you know, you just got to keep plugging along and hope that you know, the next person sees the validity and the value of what you have to offer.
Yeah. And I think more people are wanting that now because, you know, I started my practice in 2020 during the pandemic and I started it online. So I was just doing regular talk therapy. And then when I ended up moving to an in-person format, that's where I started offering yoga. I'm also a Reiki master. So I offered Reiki. I have a massage therapist on staff now, and people love it. Like I think that has really brought so many people in the door. So many people saying things like, "Oh, this is like a one-stop shop. Like this is great. I can do my therapy and then I can go get a massage." Right? Like, so I think people do want this. So if we just make ourselves visible and we show people what we have to offer, I think that you know, I would be surprised, honestly, if facilities, hospitals turned people away who were willing to do this because there is such a need for it.
Right. There's a need globally for this. And I mean, again, if we've learned nothing from things like the pandemic, you know, we need this more and more and more, where we need to allow people to be present, be grounded, which might seem like a really simple thing, but as we know, so many people are struggling. And, you know, if we can help and if yoga can help in that way. And just like you said, you had this fellow who came to see you yesterday who was an Orthodox Jew who this wasn't really in his portfolio.
Yeah.
And, and as he left, saw a different side of things, right? Understanding that this isn't a religion. This is just a therapy, another alternative therapy, right?
Yeah.
And you take from it what you want from it, right?
Exactly.
You can't force it upon anybody. So, but I mean, I think it's just amazing work. I mean, I was mentioning, well, if I didn't mention it in the intro, I'm going to mention it now that I met Lauren virtually many, many years ago when she was first starting to practice, and saw her transition into where she is today. And it's really quite amazing, right? And there were hurdles along the way, personal and professional, I'm sure.
Oh, yeah.
As we all had. But, it's just really amazing to see full circle, like what you've done and how you've just taken this, to another level, which isn't easy work. We discussed that sort of off the air for a few moments, where we were like, well, it's just a lot of grinding day in and day out, but ultimately it's making a difference in people's lives. And I think that's really something you can take home and take to heart, because it's really amazing to see. And it's just wonderful. And that's why, we were really adamant about having someone such as yourself with this sort of background on our leadership team as we're building, because we see mental health especially as a huge aspect where we can actually make a big difference, right? And everything starts from little tiny steps. So we just keep stepping away and keep doing it. And you know what? At some point, the tables have to turn, and the difference is going to really be obvious to mainstream healthcare systems and insurance providers, which, on the other hand, that has a lot to do with funding and money and all the rest of it. But, I suspect if insurance providers and others realize that this is just as beneficial as having a massage therapist or anything else, they'll be on board.
Right.
But I do feel like we're not too far away. But it's still going to be a work in progress. So thank you for all the work you're doing, all of your colleagues who are doing this type of work, and all those people out there who are thinking about doing this kind of work. I would say just give it a try, just give it a whirl. We've got nothing to lose. I mean, bringing something like this to people who really need it is a gift.
Yeah, absolutely. Right. And like you said, I mean, it's free. You can do it anywhere you want. There's no side effects except for good ones. Right. So it's not like taking a pill and then you have to wait and see what kind of side effects you get. And then you take another pill to take care of those side effects. Breathing, doing yoga stretches. It's something you can do anywhere.
Right, absolutely. And that's the greatest thing. It's free. Like it doesn't cost you anything. You have nothing to lose, right? And there's so many teachers out there. There's so many videos. There's so many studios. There's so many online portals. I mean, there's just a huge amount of things out there that you can access, and for very little cost, right?
Yeah.
And again, it doesn't have to cost anything. Right. So, well, thank you for spending your time today with us. We really appreciate it. And, we're going to see more and hear more of you over the next little while, especially we've got an upcoming wellness retreat happening, and you're going to be part of that. That's for the GOYA members. So there's so many things. And, as we begin to build out how we as an organization can help in this aspect by bringing this sort of thing to the mainstream, it's going to be an exciting time. So thank you. And thanks for being with us today.
Thank you.